Hi everyone.
Welcome to our podcast, Health Data Decoded.
I'm Ed Hill.
And I'm Samuel Ball.
We are researchers working at the University of Liverpool in health data science, and we are part of CHILL, the Civic Health Innovation Labs.
CHILL's an interdisciplinary team of researchers, NHS staff, local government and charities looking to use data and artificial intelligence to improve health outcomes in a responsible way.
This work, as well as bring innovation and improvement to health, can also help with our social well-being and the economy.
In this podcast, we'll be interviewing collaborators, researchers and professional support staff within CHILL to better understand what they do in their roles to improve health outcomes for the local area.
We'll be delving into questions such as, what are their day-to-day tasks? How did they get into the role that they currently have? And what advice would they give if you are interested in getting into this area of work yourself?
So join us in our journey to understand better how we can use data to tackle global health challenges and local ones within the Liverpool City region. Hello everyone and welcome to Health Data Decoded. My name is Sam Ball.
And I'm Ed Hill.
So today we're joined by Jenny Garden, who is the Senior Communications Manager for Mersey NHS Trust. So before we get started, Jenny, do you mind telling me what a Senior Communications Manager does?
Yeah, sure. So I lead comms for mental health research in Mersey. So Mersey is one of the largest NHS trusts in the UK. So we provide mental health and physical health services. So we have about 11,000 staff and we cover an area kind of within Cheshire and Merseyside, which covers, I think it's population about 1.4 million. So a really big trust. So we are very much a research active trust as well. So we've got a brilliant research delivery team. So kind of my job is to really amplify and promote kind of all the fantastic work that's going on there to kind of improve care and treatments. But also a really kind of big part of my job is leading, I should say, the communications for the Mental Health Research for Innovation Centre. So, or M-RIC, as many people know it. So we are a partnership of the University of Liverpool and of Mersey, and our aim is to deliver groundbreaking research, and we cover a number of themes. So kind of some of the themes that we cover are data, kind of, how we use that to kind of better understand mental health problems. Also digital, so whether that's like kind of creating, a personalised mental health avatar for someone, or apps and games for children and young people. We also kind of cover sort of novel treatments for mood disorders and also for psychosis. And also as well kind of looking at the system for population mental health and how we can improve that to kind of improve mental health services. So my kind of role really is kind of sort of leading the communications channels. So that's looking at kind of like the website, the social media, but also we get involved in events, writing press releases, promoting all our initiatives, working with stakeholders as well to amplify the work that we're doing, all kinds of different things really, whatever is kind of needed.
Brilliant.
Thank you, Jenny, for that overview. So you've already given insight to the fact there's so many different formats for communication that's involved in your work, which is really fantastic to hear. So you've mentioned, one of these partnerships between University of Liverpool and Mersey is the Mental Health Research for Innovation Centre, or M-RIC. So this is one of the projects that the Civic Health Innovation Lab, so CHILL, has involvement in. So would you be able to share with our listeners, basically, the background to how you became involved in the M-RIC project?
Yeah, sure. So I've worked in public sector communications, I can't believe this, for almost 20 years. And about 12, 13 years of that has been within the NHS. So my background is very much kind of, I've worked in a community trust before, and I've also worked for an NHS clinical commissioning group, which is now kind of part of the NHS Cheshire and Merseyside. So when this kind of role came up, I just thought it was a fantastic opportunity, really. I knew it would be a challenge because I've never worked in kind of mental health before. I've also never worked in research communications before. So I saw the role and kind of I came on board in about April 23. So it was actually before M-RIC had been announced. So within a month of it being announced, I very much had to, within a month of starting in post, it was announced. So I very much had to get that communications infrastructure in place and launch the website, launch the social media. So it was a bit of a challenge, but, kind of thankfully it all came together.
And yeah, being there at the very beginning, and like you say, being an important part of announcing to the wider audience about the project and what it's going to do, that seems like a very exciting time, as well as there being, like you say, a lot of tasks and actions to perform. But it seems a very exciting time to be involved. Oh,
very much so. And you're right. I think kind of often with communications, you kind of come into a very established organisation. With kind of set processes, etc. But to kind of come into a project, at the very beginning and to kind of create, be involved in the branding, the creation of the website, everything, it's just been fantastic, and I've really enjoyed it.
That's awesome, brilliant.
So obviously there's these massive mega events like the launch of huge projects like M-RIC. But day to day, what does your day kind of look like?
Gosh. I would say no 2 days are the same in communications, and sometimes you can have your day planned and it can completely change depending on what emails come in. But kind of some of the type of stuff that we do is we devise communication plans and strategies. We write blogs, press releases, building web pages. I might be interviewing somebody. But so I'm used to being in your role rather than this role. I'm more comfortable in your role, I'll be honest. But also like event planning, social media management, graphic design, photography, all kinds of managing budgets, meeting stakeholders. It's really, really varied role. But it's never, ever boring. It's very interesting.
It's good to hear, isn't it? It's so funny, but it's interesting, isn't it, being on the other side of the camera this time? It's like, it takes some getting used to, I think.
It does, very much so, and I'm much more, like I said, I'm much more comfortable on your side than being in the spotlight and being interviewed.
And it's something I think we're consistently kind of hearing from our guests is the day-to-day. It's not necessarily very standard from one day to the other. It's like there is perhaps a range of tasks where each day I'll probably be working within this set of things, but each specific day, like you say, things can arise where it's like, okay, this now becomes the priority task, and then like moving things around. So like the management and time management, therefore, seems a very common factor in a lot of the roles that we've been kind of delving into. So thank you for sharing that with us. And then in terms of, so perhaps outside those tasks, then other ways that you kind of present your role and contribute to, say, your work for the NHS. So in terms of, say, presentations and also training and mentorship roles, how much involvement do you have in those type of contributions?
I think kind of one thing I'm really a champion of, and kind of anyone who works with me will know this, is that I really want our communications to be accessible and inclusive for everyone. It's really important that we communicate research in a way that everybody understands, and we avoid using jargon and terminology that kind of doesn't resonate with people. So I've been committed to doing that within M-RIC since I started. And there's lots of ways that we do that within M-RIC. So, I very much try to use plain English for all of our kind of communications. It's really important. Simplify that complex research language. But also, in terms of our website, I make sure that that adheres to public sector website accessibility guidelines. So that means that kind of things like people who've use assistive technologies like screen readers, that they can kind of use the website and understand the information, and everything kind of supports that, the way that the website is structured. But also, in kind of terms of reaching our communities as well. So, we do translate materials into other languages. We make videos in other languages. And we also create easy read documents as well, so that we can kind of support people, may have learning disabilities who want to know more about our projects. So I guess kind of a good example of some of the work that we're doing is we're currently running a campaign called Count Me In. And the aim of Count Me In is to widen participation in research. And we launched this about a year ago. And basically what it means is that if you are a Mersey Care service user, you will be automatically opted in to hear about research opportunities that are relevant to you, unless you choose to opt out, which you're able to do so. And there's no pressure to take part, but it's just about kind of trying to engage and involve more people in research, which is obviously really important if we want to improve care and treatments. So kind of what we sort of did to do, to kind of get this started, really, to do a campaign that we could kind of make as many kind of service users aware as possible of what we were doing, is we knew we were going to have to use a variety of different channels to reach people, but also we wanted to kind of make the sort of messaging and the materials, so that they really resonate with communities. So how we did this is we have a fantastic group of M-RIC service user and care representatives and public advisors who are absolutely brilliant. I love working with them. And they kind of supported us to kind of create those materials. So we created an animation and we created, kind of visuals and, for posters and leaflets and lots of different things to get that messages out, to get those messages out there and make sure we did it in an accessible and inclusive way. And we used a variety of different methods as well to kind of reach people, because we knew that was really important, because you can't use one channel to reach everybody. So we used things like patient screens in waiting areas. We had information on patient letters. We've done a radio campaign on Greatest Hits Liverpool, which was one, until recently a Radio City. We've advertised in the Liverpool Echo, both online and in print, because we know kind of that older audience might still, be reading the print version of the Echo. We have lots and lots of community events as well. So we're doing that to this day. I think we were at an event the other day at Age UK to just get the message out there as much as possible. We've done translated materials, easy reads. So there's lots of different things that we're doing with the Count Me In campaign to make sure we reach, everybody in our communities.
That's a brilliant initiative, and I think it's really important that you've highlighted about accessibility and being inclusive. So it's not just about literally what is written or presented, it's also about how it is going to be shown to the public. So you mentioned that the technology that you can use that is available, and I suppose over time, and actually this might also shift, because now we have mobile phones where we can, screen sizes have got larger, so we can actually view videos, etc., via a mobile phone, whereas back a couple of decades ago, that wouldn't have been possible, wouldn't be feasible. We've got tablets now, PCs as well. So I suppose as part of the role, it's also seeing these technologies potentially changing and their usage changing and adapting to that as part of this. It's another important aspect of your overall role.
Sorry, go on. Yeah,
I was going to say very much so. Yeah, is you have to adapt all the time and keep up with kind of emerging trends and changes, which can be one of the challenges as well, really, of keeping up with everything.
I mean, I love the point that you made about the Count Me In thing, because I think that as researchers, we know that we need to be involving the public in our research, but I think sometimes the challenge is how can we get them in and also know that we are actually listening to their concerns. And it's not just a box-ticking exercise in saying, we've spoken to the public, yep, okay, we're off to do our research kind of thing. And I imagine that's quite challenging in a way, kind of reaching out to all the different groups of people on all these different platforms and mediums. Are there any skills in the role that you've developed that have been particularly challenging that you didn't have any other previous roles?
Absolutely. I think I'm not... Actually, I don't know if I would say in terms of roles, but in terms of kind of communications, and because it kind of applies to lots of different communication roles, I would say. It goes back to sort of the previous point you made, really, about how, we're constantly having to evolve and, our skills. So when I started in 2006, can't believe I'm going to say that, in comms, I was working at a fire and rescue service, and we didn't have social media accounts then. and it was very much about kind of media management, and traditional media was, very, very important. But obviously we've seen a decline in traditional media and the emergence of, social media. It's just been absolutely huge, and the amount of different social media platforms as well for different audiences. So I've had to adapt my skills over time. So I started off, I trained in journalism. I started off I was very much about written skills, whereas, now I do video editing, photography, videography, video editing, I quite like to learn podcasting. So, all that's really important. And also I would say, just even within the last year, is the emergence of AI in communications and how we use AI. And there's a lot of debate, I think, amongst communicators about whether it's a good thing or a bad thing, really. I see it as a useful tool. It helps you kind of maybe refine a headline to make it more engaging, or, kind of plan out a report. But I don't think it will ever replace communicators, because I always think you're going to need that emotional intelligence of an experienced communicator on that strategic thinking. So if you're planning an internal communications campaign, how it's going to be received by staff, or if you're in a crisis communications situation and you have to respond quickly, I do always think you are going to need those experienced communicators to support your leaders with that.
It's funny, we just had Sam Hoshion on last month, and he comes from the LLM background, and he was talking about how he kind of knows that we need to have that kind of experience and wisdom as kind of experts in the field that an LLM might not be able to replace. So, and we hear that from kind of everyone in the AI is fantastic and it's coming, but also like the human element's still there.
Yeah, definitely. It's important to it's a tool, I think, like any other tools that have kind of emerged, over the past 20 years. That's how I see it.
Yeah.
Cool. No, I'd be in agreement with that. So this resources is now here and being developed and can be used. It's a question about trying to use it skillfully and the most useful way to then hopefully help enhance the communication which is already being done by the communicators. And so something we've been asking each of our guests is, as a way to conclude our conversation, is to ask them it's speaking to others about who might be interested in working in a healthcare related role. What would you like the listeners to basically take away from our conversation today?
I think, I would encourage people to kind of enter sort of healthcare communications. It is fast paced and it is challenging, but I do think it is incredibly rewarding as well. You need to be versatile, you need to be open to learning, like we've just talked about, kind of improving your skills all the time and learning about the latest social media trends or whatever it might be. But this year alone, I think I've done things like I've deepened my understanding of accessibility, what we've been talking about, previously. And like I said, I've been on a recent course as well, which I get about social media trends, which I found incredibly useful. And although it can be a bit stressful at times when you're juggling multiple projects and multiple stakeholders, everyone thinks their work's a priority. So kind of managing that can be tricky at times. But the impact, I think, of healthcare communications is just really worthwhile. So whether that's, increasing research participation in this case, or in previous roles I've done where it's been about increasing vaccine uptake or promoting, a brilliant initiative that a service has kind of, instigated that will, support the patients. It's just incredibly rewarding to see kind of the health benefits that communications can bring people.
It's so funny, isn't it? I mean, we talk about it all the time, about how the health research kind of sits within an ecosystem of stuff that is really needed to support it and make it impactful. And without communication, if no one knows about what we're doing, we can't recruit. And if we build something amazing that helps patients and they don't hear about it, they can't use it. So it's so important. Well, thanks, Jenny, for coming to the podcast. As always, if you like listening to the podcast, you can subscribe to us on Spotify and on YouTube, and we'll see you next month.